Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare home care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of the station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
All right. Hello, South Florida and beyond, and welcome to the You and Your Doctor show, living a longer and healthier life, for Tuesday, November 27th, 2018. You're going to recognize our guest tonight. He's been on the show. I think this is probably your fourth time, but I got to look back. Third or fourth time. It's Dr. David Selzer. He's an internist, so internal medicine, NYU Langone Medical, on Clematis Street in downtown West Palm. And then also, which you brought to my attention last time, thank you, Doctor, you guys also have NYU Langone Cardiology Associates, Delray Beach on South Military Trail, right near Delray Medical Center, I believe. So without further ado, welcome back to the program.
Thank you. Good to be here. Good to be here tonight.
If you could, again, just give us a brief little bio about what your medical specialty is and what you do.
So my name is Dr. David Selzer. I work for New York University. We have offices in West Palm Beach and in Delray. Our office is at 16244 South Military Trail. It is at the corner of Military Trail and Linton. My specialty is internal medicine, and I also did a fellowship in nephrology. So I am doubly trained in both in internal medicine and kidney disease. I try to use all part of my training in order to give the patient a complete treatment care and to evaluate the person's entire body before making any treatments.
And we know that's so important, discussing, the medical terminology we do on this show. Now, most of our listeners are more of the seniors and baby boomer population. Do you tend to see that age range of patients in your office in West Palm Beach and in Delray Beach, or do you see a wider range of patients? And how can you help the baby boomer population, I guess, and seniors and into geriatrics? It's a kind of double question there for you.
So I'll try to answer one at a time.
Okay, thank you.
I see all patients from ages 18 and up. This time of year, because it's after Thanksgiving, you start having the snowbird effect, and I consider myself a snowbird specialist. One of the major parts of my job is to coordinate care with NYU, especially for our New York-based patients who are now coming down to Florida. So you can ask, what does a snowbird specialist do? The number one thing that you have to do when you're dealing with snowbirds is to go through their records and obtain their records from their doctor up in New York. And that is partially me and partially my office. And I give a lot of credit to the office staff who come along and, make that extra phone call, that second, that third, that fourth phone call in order to get records from the busy practices up in New York and to make sure that I have all the information in order to make a judgment call. Number two is once I get those records, I have to look it over and ask myself, does this make sense? Usually it does, and usually you try to give benefit to the other physician and ask yourself, well, why did he or she do this? And usually there is a solid reason for what someone else did. And then the question is, what do we do going forward, and how to get that person to their best optimum health situation? In regard to treating baby boomers and what is the best way to treat them, the most important thing that I can give to a patient in that age group is my ears. It sometimes takes patients a little bit longer to express themselves when they get into that senior citizen range. If you give that person that extra moment and not jump down their throat and let them express his or herself in a well-articulated way, you'll be able to treat them so much better. But if you pressure them and you try to get an answer quickly, it doesn't work. You lose that doctor-patient relationship very quickly. So to answer your question, the best thing I can do for a baby boomer or someone who's a senior citizen is give them my ears and my time to let them express themselves so they feel comfortable with me.
That's fantastic, and we're so appreciative of your time this evening. It's Dr. David Selzer, internist, NYU Langone Medical, and as Dr. Selzer mentioned earlier, fellowship trained in nephrology, which we're going to get into as well. So tell us a little bit about your experience, education, and training. I know, obviously, you're fellowship trained, but why did you decide to become a doctor, and then where did you go to medical school, residency, etc.?
Well, I think everything begins in the home. I grew up in Rockland County, New York, and I am the son of amazing parents, Maria and Mona Selzer. They always taught me the importance of giving and helping others, and that was one of the main reasons why I became a physician. They sent me to Yeshiva University for college, and then I went to medical school in Chicago at the Chicago Medical School of Rosalind Franklin University. I then did my training at Westchester Medical Center in Westchester, which is right over the bridge from Rockland County. They connect to each other. And that was truly an honor and a privilege to be able to do that, because I was able to work with patients from my hometown. And when you do that, you learn to care about people a little bit more when they're your friend's neighbor, when they're somebody's parent, somebody's child, and you really know where they're coming from, and you really get to know those people, because it's not like a random person out there. It's someone who you know and someone who you care for when you're dealing with your hometown. So I was really blessed to be able to come back home and do my residency training. Afterwards, I ventured out to the Upper East Side of Manhattan. I had actually gotten married right before I started fellowship, and it was closer to where I lived in Passaic, New Jersey. So I did my renal fellowship in Lenox-Hill Hospital on the Upper East Side. And then with my wife and daughter, we migrated down to South Florida. It's been a great experience living down here. I do not miss the winters. Every day I look at the Weather Channel and I see that it's negative 12 degrees in Chicago, where I did my medical school training, and 12 degrees in New York. So I'm very happy and lucky to be down here in South Florida.
And Chicago got heavy snow recently, and we're getting our first little cool snaps. So how'd that feel on the drive in? That's awesome out there, huh?
Well, my wife, she really loves it. She likes the cool weather. My wife and daughter were recently in Chicago, and my daughter got to see snow, and that was something
awesome.
she loved.
Yeah, my mom's from Chicago, so I've seen it a few times up there. Boy, they get a lot of it up there. I was watching on the news this morning. Unbelievable with all the... Some people hadn't even got home from Thanksgiving yet. Can you believe that? In the Midwest. They were still trying to get home with flight delays. That's what this news report said. I couldn't believe it.
That's why you eat a lot of turkey.
And we're so happy to have you, Dr. David Selzer, internist with NYU Langone. Now I want to get into some of the things we weren't able to talk about. One of the things I love about your website on nyulangone.org, you just look that up, or just even Google Dr. David Selzer, S-E-L-Z-E-R, on the Google, and you'll find he comes up right top. So the amount of areas of interest that they have that you cover on there is just amazing. It must be 100 different terms. And some of the things that I've asked you about in the past, I know you're very diabetes expert, but we didn't get to talk a little bit about antidepressants last time, or sleep apnea, or diabetes. we touched on diabetes a little bit, but we didn't get into it like I'd like to get into it for listeners and viewers. The reason I brought up antidepressants to last time is I actually read a New York Times article I was telling you about. You may have seen it before I even told you that people were having a hard time getting off antidepressants. And I wanted to ask you, since primary care is playing a bigger role than ever in mental health care with internists like yourself, like you've that is grown to where you're now an expert in that as well, because you have to be with what's going on out there. And so what are antidepressants and how do they work?
So I think pharmacology is a huge part of medicine, meaning understanding how medications work and what they do. So before we go to SSRI, which are selective serotonin receptor inhibitors, which is the main class of medication which is used for treatment of depression, we have to understand what it is and what happens. So for comparison, let's take insulin. So insulin works by lowering sugar, and right away you see the results. Let's take blood pressure medication like metoprolol, which is a beta blocker, and it works by slowing down the heart. You give the medication, it works relatively quickly. So now let's look at antidepressant medications. They work by selective serotonin receptor inhibitors, happier end of the spectrum. So one should look at an antidepressant as a molecule that affects both the serotonin, but also has effects on all other proteins and molecules that make patients feel better and less depressed. So that's why it doesn't happen. The effect of the SSRI, the antidepressant, doesn't happen right away. It takes time for it to work. It generally can take between 2 to 8 weeks for a person to see the effects of the antidepressant. So the question that you asked me was, how do I stop it? Now, once we understand that it's not just a quick fix to start, we can also understand that it's not just a quick fix to stop. So when you're asking a person, now, it's a clinical debate when you should start and stop medications. So let's say a person comes and they're depressed and they try it for 2 to 4 weeks and all they're getting is the side effects and not the benefits. The question remains, should you let that patient continue for another 4 weeks to see if all of a sudden the benefits are going over, are worth more to you than the side effects? So generally I'll give a patient about 2 to 3 months to see how it works on their antidepressant before stopping it. Now there are some significant side effects when you start an antidepressant. Namely, you can have weight gain. So most people do not like when they gain weight. Other side effects are sexual dysfunction. Patients have a lot of difficulty having orgasms when they're on antidepressants. And there is like a very bad side effect called serotonin syndrome. That's when a patient's on a lot of SSRIs, a lot of antidepressants, and also other medications that affect the serotonin. And that can lead to a hyperthermia, where the body gets very warm and very stiff. That's called serotonin syndrome. That usually doesn't happen, but it is a side effect, and patients and physicians should be aware of that as like the worst case scenario for as a side effect. So the question is, how do you stop it so you avoid what we call discontinuation syndrome? And that happens when you just stop the medication, and that's always a bad thing, as we discussed. So what I typically do is, let's say 3 months have gone by, patient feeling, this isn't really working out for me, I'm not happy with it, this medication's just not working. So what I'll tell them to do is, instead of taking it 7 out of 7 days a week, go to 5 out of 7 days a week. Just take it on the weekdays and give your body the weekends to adjust. And let that go for 2 to 3 weeks. And then do 4 out of 7 days, and then maybe every other day, and then every third day. And it might take 2 months to stop it, but I'd rather be safe than sorry. And also the question is, which antidepressant did you give them? So it all depends on what we call the half-life, meaning how long does it take for half of that medication to get excreted. So some medications are a little bit shorter and some are a little longer. The shorter the half-life, the quicker that medication will go out of you. The longer the half-life, the longer it will stay. So for example, if you're looking at Prozac, that has the shortest half-life in the class. So that medication is good to give to a patient who you are concerned that they may just stop the medication. So since it has a short half-life, it won't last as long. And then like another type of medication like Paxil has a much longer half-life. And so that medication will last in the patient longer.
And that's a great explanation, and that's why you need an expert in your corner in healthcare right there. I mean, that's unbelievable, your knowledge on that subject, and this is something that, you know, an internist, I wouldn't think, I was thinking internal medicine, but that's all connected.
Well, the brain is connected to the rest of it.
Yeah, it is, sure is.
Side point.
Let's take a quick break, and on the other side, get into a little bit about sleep apnea, because that's another thing that's growing in this country and a big problem on the You and Your Doctor show.
Sure.
Fantastic.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Hi, I'm Deanna Barron, RN, with All County Health Care. You know how I know that I've done a good job? We say goodbye. After you understand the medications you take, once you know that gaining 2 pounds in a day means you should call the doctor, when your wound is healed, when you can use your nebulizer all by yourself, when the goals that you and your all-county healthcare team of nurses, therapists, and aides established are met. We say goodbye. Very nice to meet you, and I hope I never see you again. And I mean that in the nicest way possible.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, South Florida, and welcome back. We're here with Dr. David Selzer, internist, NYU Langone Medical in West Palm Beach and Delray Beach as well. Dr. Selzer, let's talk a little bit about headaches. Another reason to see an internist like yourself. You guys are, specialists, experts in internal medicine, mental health care, and now people come and ask you left and right about headaches. And I didn't know this until you sent me that email. There's at least 2 different kinds of headaches, even starting on, I may be wrong, primary and secondary is what I didn't know. So thank you. I learned something new every time you're on the show. So what's the difference between primary and secondary headache?
Well, primary headache is what physicians typically see. You can sort of break it down between migraine headaches and tension type headaches. But before we get to that, let's just talk about secondary headaches for one moment. Secondary headaches are where you have either a headache that is waking a person up in the middle of the night, and that is concerning for cancer, especially when there's a weight loss associated with it, or when someone has what they call the worst headache of their life, and all of a sudden they start feeling dizzy and confused, so that you're concerned about what we call subarachnoid hemorrhage, because all of a sudden an artery inside the brain has just snapped. So those are the secondary headaches, and those are very severe, and those have we have red signs, and those are the really bad things that can happen. 99.9% of the time, that's not what a typical physician will see. An emergency medicine physician might see that, where someone comes in and they start losing consciousness with a headache, or they start having serious problems. But in a typical physician, when a patient comes in and they start telling you, hey, I have a really bad headache, what do I do? So you have to differentiate, is this a migraine headache or a tension type headache? So let's go over the criteria for migraine versus tension. So tension type headaches are typically bilateral. They last only a short period of time, and they're not disabling. So you come home from a hard day's work, you're like, my head hurts me. And you take maybe 2 Tylenol, you rest on your head, you rest your head on the couch, maybe you listen to a little sports center, and you feel a little better. So that is your typical tension type headaches. Then on the other hand, you have what we call a migraine type headache. And it's easy to go through what classifies a migraine-based headache based on the pound mnemonic, P-O-U-N-D. So pound, P stands for pulsatile. You start feeling it pulsating on one side of your brain. O for onset, meaning it lasts between 4 to 72 hours. So it lasts for basically 1 to 3 days, as opposed to a tension type headache will only last for less than 4 hours. U stands for unilateral, and N stands for nausea or vomiting, and D stands for disabling. So if someone tells you that they have a migraine and they're functioning normally, they don't have a migraine. If someone says that they're able to walk around all day with a migraine, it's probably not a migraine. Usually migraines are much more disabling, they last for a very long time, and they really affect patients. As long as you have 3 out of 5 of these criteria, you have what we call a migraine. Furthermore, migraines can also be complicated by an aura. So an aura is where you have a sensory phenomenon with it. So for example, some patients have visual auras where they start feeling that light is shining into their eyes, or they'll start hearing funny sounds through their ears, or their stomach. All of a sudden they start getting gastric pains, and all of a sudden there's certain issues that are happening inside the body related to the migraines. Now it's important to note that women who have migraines that have auras associated with it, they have an increased risk of stroke, especially visual auras. So physicians have to be aware that when you have a patient coming in telling you they have auras with migraine or describing these type of symptoms, always look if they're on birth control pills. So if they're on estrogen-containing birth control pills, like a young girl between 20 and 40 years of age, and they're coming in with migraines, you have to take them off that estrogen-containing birth control pill in order so that their stroke risk goes down. Because it would be terrible for a 25-year-old female to get a stroke, something that could have been prevented. So now that we've figured out what tension headache is, what migraine headache is, and some of the bad things that can happen, the question is, how do you treat it? So the best ways to treat it are with NSAIDs or triptans. So what type of NSAIDs to use has not really been proven in the medical literature. So you can use aspirin, ibuprofen, even indomethacin that can be used to help get rid of that headache. Also triptans, like sumatriptan, or otherwise known as Imitrex, those can be used in order to get rid of the migraine. Now the key in treating migraines is not treating it right away, because anyone can sort of treat that. You give the NSAID, give the Imitrex, the sumatriptan, and the patient starts to feel better. That's child's play, in my opinion. The key is making sure that the patient doesn't get it and doesn't require all these pills all the time. So one of the main goals is prevention, and that can be done with either propranolol, if you think it's more because of related, especially patients, they get very nervous. So propranolol helps by slowing down the heart rate, and that can be preventative for migraine headaches. Another issue that can happen is to treat the patient with Elavil, which is a TCA, tricyclic antidepressant, and that can also help a lot with prevention of migraines.
That's great. I mean, preventing it before it happens, instead of the other way, the child's play. So I like that as well. And great acronym there, POUND, that we learned as well. Well, we got less than 2 minutes. This always happens when we're getting into so much information, but we love that. Sleep apnea, is it on the rise? When is a sleep study needed? Is this something I talked to my internist about?
Well, since I have about 90 seconds left, yeah, sleep apnea is on the rise. I would talk to my internist about it, especially for that patient that is coming to you saying that they are getting enough hours of sleep. The typical person might need between 6 to 8 hours of sleep to go, and they don't feel refreshed. But we'll talk about it more next time as the music is playing.
Yeah, right? Definitely we have to go on an hour show with you, but and I think people will find A lot of information online with Dr. David Selzer, Selzer. Just Google him or go to nyulangone.org. He's got offices in West Palm Beach and Delray Beach, 561-365-3000. And we'll talk to you next time on the You and Your Doctor Show.
Adios.
Thank you.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.
The opinions expressed on the preceding sponsored program were strictly those of its host, guests,